Hello, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. With the news that COVID-19 vaccinations will be taking place soon, the questions the Department of Health received this week focused on the vaccines. Linda from zip code 63113 asked, what's one key concern for the Department of Health in planning for vaccinating St. Louis residents? It's important to remember the two vaccines that are furthest along in the governmental approval process require 2 doses. This includes the Pfizer vaccine, which was approved for use under an emergency use authorization on December 10, 2020, as well as the Moderna vaccine, which is still awaiting emergency use authorization. If both vaccines become available to the public, it will be crucial to keep track of which vaccine is administered and where to obtain the second dose within the required time period. The City of St. Louis Department of Health is working closely with state and regional partners to establish a distribution plan that prioritizes populations disproportionately impacted by the pandemic. As public health planners and practitioners, we are committed to engaging our communities in a meaningful way in the planning process and will build on long-standing community relationships and develop a community-centered, community engagement approach to ensure its access. Princeton from zip code 63147 asked, if African Americans and other communities of color are being disproportionately impacted by COVID-19, why do so many have apprehension about receiving the vaccine? Limited confidence and skepticism among some African Americans can be traced to historical scientific governmental experimentations that took place on minorities. For examples of those experiments, we need only look at the Henrietta Lacks cervical cancer tissue cells and Tuskegee syphilis experiments. These types of modern-day experiments show why apprehensions still exist. Also, because the vaccines are being developed so fast, there is concern about the safety and effectiveness of the vaccine beyond African American communities. Traditionally, it has taken many years to develop a vaccine, prove its effectiveness and safety, and produce the vaccine in sufficient quantities for public use. This timeline is shortened for SARS-CoV-2 vaccines in development. There are several ways this has been made possible. First, some clinical trials have combined phases 1 and 2 to assess safety and the immune responses. Secondly, because of the high number of new cases of COVID-19 in many places, differences in disease risk between those who receive the viral vaccine and those who receive the placebo or comparison vaccine can be measured more quickly than in the absence of a pandemic. And thirdly, the United States government and others have invested heavily in building the manufacturing capacity to produce large numbers of vaccine doses before the findings of the phase 3 trials are available. Typically, vaccine manufacturers wait until the phase 3 trial is completed and shows safety and efficacy before making such a large investment in manufacturing capacity. However, phase 3 clinical trial data for the Moderna and Pfizer vaccines show that they are over 90% effective and safe. None of these factors that contribute to the accelerated development of a vaccine for SARS-CoV-2 imply that safety, scientific or ethical integrity are compromised, and that shortcuts have been made. Xavier from zip code 63120 asked, there has been talk about who's set to be first in line for the proposed COVID-19 vaccines in our region, and we've seen that the plans in Missouri and Illinois are slightly different. How does the City of St. Louis plan to distribute the vaccine? The City of St. Louis Department of Health has been working closely with federal, state, and local officials and the healthcare community to prepare for the arrival of a safe and effective COVID-19 vaccine. At first, there will not be enough doses available for everyone at once, and so residents will get the vaccine in phases. At this time, the city is making plans to use the CDC's and Missouri Department of Health and Senior Services phased administration of COVID-19 vaccine. Phase 1 will prioritize vaccinating healthcare workers, first responders, persons living and working in congregate living facilities, and others on the front lines of the COVID-19 pandemic response efforts. As vaccine distribution extends past this first group of recipients, additional information about when and where someone can receive a vaccine will be distributed. The general public, those not falling into one of the higher risk categories, is not expected to be offered vaccine until later in 2021. Jason from zip code 63116 asked, will we still need to wear masks and practice physical distancing once a vaccine is available? That's a great question. We will still need to wear masks and practice physical or social distancing until a large proportion of the population is vaccinated and we are sure the vaccine provides long-term protection. Initially, we will not have enough vaccine to vaccinate everyone who wants the vaccine, and the virus will still be transmitted and spread in our community. Thank you for tuning in this week, and thank you to everyone who sent questions. Be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well.